I've been a physical therapist for 16 years, and in that time, one of my special interests is treating the hip joint. A few of the conditions that are very common are hip osteoarthritis, femoral acetabular impingement, and labral tears. With hip osteoarthritis, the hip joint gets very restricted and inflamed and painful. It's hard to bear weight through the joint when you're walking, so sometimes the simplest tasks become incredibly painful. Standing at a dinner party, cleaning the house, exercising, all this increases your pain. So a lot of people try to avoid these activities. The hip joint gets very tight, so you lose range of motion and mobility. There's a lining around the hip joint, sort of like the lining around the shirt, the shirt on my shoulder. It can get very tight, and so it's hard to move. That occurs at the hip joint. So the person can't cross their leg, they can't bend forward, they can't walk because their hip won't extend behind them. And so when you come to a physical therapist or a chiropractor or an osteopathic physician, we do a lot of hands-on techniques to try to loosen up the joint capsule. Even though there's no cure for arthritis, there's no cure for aging, there are treatments that you can do to loosen up this joint capsule. And kind of like a vice grip, on a joint, as you loosen that up, the pressure decreases in the hip joint and you're able to move more freely, you have less pain, and then you can get on top of your strength and your exercises more. When people can't exercise 30 minutes a day, your risk for heart disease, diabetes, obesity, stroke, all these things increase. Cancer, depression. So it's very important as humans that we keep moving. A lot of times you'll go to the physician will tell you, well, you definitely have arthritis of your hip and you will need a hip replacement at some point, but you're not ready yet. Some people will go 3 to 6 years before they're able to get that hip replacement. It's good to put that off as long as possible, but not so long that you're compromising your quality of life or your functionality. So if you're a candidate for conservative therapy, meaning that the surgeon doesn't believe that you should get a hip replacement yet, well, you don't want to sit around and suffer and do nothing, right? So you'll get prescribed physical therapy. And when you come to a physical therapist, we'll start to begin doing these hands-on techniques to stretch out the joint. As we do this, we'll start to educate you, instruct you in certain specific exercises to promote that mobility, and then start putting strength behind that mobility. At this point, you'll be able to do more cardiovascular exercise for weight loss. You'll start becoming more fit and conditioned. All this time, you might be feeling better, you're increasing your functionality. Now, you're still on a path for a hip replacement. Even though you're improving your strength and conditioning, we know your hip is still degenerating. So the great news is that when you do therapy, whether you can put off the hip replacement or not and for how long, that all depends on the individual. But it's a win-win situation. You're either going to put it off and feel better, or you're going to be just that much more prepared for that surgery. Going into any surgery in better strength and conditioning is good for you. Now, when people come into the clinic and for treatment, oftentimes they're limited by insurance policies and how long they come to the clinic. Because there's no cure, you can't treat them indefinitely. So oftentimes some people come in once a week for 6 weeks. Sometimes you might come in twice a week for 4 weeks. It just really depends. Our job is to help you get that hip moving, help you keep it moving, and teach you an independent home program to keep performing. What a lot of patients will say when they're in the clinic, there are a lot of hands-on techniques that feel really good. They provide a lot of great relief for that patient temporarily. So one of the techniques is called long axis hip traction. And you'll see on some of the other videos that we have in photos is that when the person's lying down, you grab them by their knee or their ankle and you pull on their leg to decompress that hip joint. When you get arthritis, it gets really closed in there and tight and gets really tight around that ball and socket, and that increases that pain and pressure when you're walking on that. So by traction, you can increase that space and decrease the pressure on the joint. Now, as soon as you let go, we know that's going to go right back. And so the manual therapy works much like antibiotics would work on an infection. If you have some kind of infection, your physician prescribes you antibiotics, you know you have to take it twice a day for 10 days consistently. No one takes their first antibiotic and waits and it's not working. You know you have to accumulate that. And by day 3 or 4 of taking your antibiotics, you start to feel better, but you want to keep the momentum going to beat that infection. Well, manual therapy in the clinic is very similar. Doing 1 or 2 sessions of manual therapy won't change a lot, but by accumulating that in a consistent manner, it starts to have some real changes around the hip joint and improving that joint mobility. As we get that person set up on their independent program and we let them go on their own, they'll continue their home program, they'll continue to feel better, but we know that studies show that as that person goes on every month, every 6 months, every 9 months, we know that their hip is slowly going to tighten back up and slowly create pain around that hip. And when that happens, you'll start to get some weakness and tightness as well as losing some functionality. And so a lot of people will come to therapy, for a tune-up every 6 months or every 12 months. Now, for those people that obtain a lot of relief with these hands-on techniques, a lot of them will say to me, hey, Tony, I wish I could take you home because when you do that long axis traction, that just makes me feel so good and I can exercise and I can be normal for a little while, but the pain comes right back, after a couple of days or in some cases a couple of hours. Can you just come home with me and do that? It's like, well, it's funny, but no, we can't. And so historically, we would teach people how to tie a band or a rope to their ankle and go into a doorway and push. Some people will go into an inversion table, which can be helpful, but the problem with inversion tables, it's not specific to the hip joint and you have to be upside down, so your blood pressure increases and the blood rushes to your head. A lot of people just can't frankly tolerate that. So how do we get people to obtain some of these manual therapy techniques at home without us going home with them? About 6 years ago, I just had this idea of coming up with a device where people could comfortably, easily, and independently perform hip traction to themselves, as well as a variety of other hands-on techniques that we do in the clinic. And that's where we come with the idea for the Hiptrac. So the Hiptrac replicates this technique called long axis traction. It provides great relief, it's simple to do, and it just allows people to, feel better to get moving. What are the benefits of feeling better and getting moving? Like we said earlier, reducing those risks for comorbidities. Taking narcotics and NSAIDs on a daily basis, getting moving to decrease your weight, to improve weight loss, to decrease your chances for cancer, heart disease. The benefits are great, and at the very least, just preparing you better for that hip replacement surgery. So the Hiptrac, we came up with the Hiptrac so it could be portable. People could take it traveling with them. It's small and sleek. It'll fit underneath their bed. They can use it on the floor. They can use it on their bed. It's very similar to historically when we use these cervical, neck traction devices and lumbar traction devices when we're treating bulging disc, herniated disc, and sciatica. Those have been around for decades with great commercial success. We've never had a device that could specifically decompress the hip joint until now. So what we do is we treat people in the clinic and then we send them home with a Hiptrac to serve as an extension or supplement to their home exercise program. In this manner, they're more compliant with their home exercises, they're taking less medication, and they're able to stay mobile and functional longer, leading to their hip replacement. For more information on the Hiptrac, contact us at 503-719-7775, or you can email us at info@medrock.com. That's MEDROCK. Thank you.